Good afternoon, everyone. My name is Spencer Richlin. I'm a board-certified reproductive medicine physician, and I'm here at Reproductive Medicines of Connecticut in Norwalk, Connecticut. And I have sitting next to me a good friend of mine,
I'm
Shaun Williams.
Yes,
Go ahead,
I'm Shaun Williams, a reproductive endocrinologist as well here at RMA of Connecticut. And Spencer and I are here to have a nice conversation with ourselves as well as with everyone out there about what patients can expect when they come here for a first visit.
I agree with you, Shaun. I think one of the things I want to throw out there is that you and I have been in this field and advocating for our patients and known each other for over 15 years, maybe 20 years, and we're very happy to do a Facebook Live as we really enjoy working together.
Yeah, it's exciting. Spencer and I actually met before we were even reproductive endocrinologists. We were
way back at a conference in who knows where.
No, we were sitting in a waiting room at an interview.
And the nice thing is we're working together, and what we really want to talk about today is the importance of making it happen, family building, and kind of demystifying what it is to come to a first visit. We know you may be, excited or nervous. We're ready for you. We have this, we got this, and we want to help you build your family.
Yeah, we both love working with each other, but we also love doing what we do and help. We love helping patients out there, and we really love seeing the end product of what we do, which is really helping everyone get to their family building goals, whatever they are. And so, the first visit is sometimes the most difficult step for some couples to take.
When you've made the step, you're halfway there.
It's, some people, they're trying. Sometimes you don't want to, come to or at least come to the realization that maybe there's something that's a little bit less efficient in the process that may need some help. It's part of individuals' lives that they feel should be well under control.
And maybe it should be easier, but it's just not easier right now.
Right. And so the first step is coming to see us.
Right. So, we always say, make the step, come see us. And we think about this discussion of first visit. What it's all about is come on in, and we'd love to see you. How I look at my first visit, and Shaun will kind of take it from there, is when you come in and you've made the step to come see us, what we'll do is we're going to have you write about yourself through our patient portal, which is really nice. So then we have information about you and your goals and dreams up front. And so before you walk in the office and meet our front desk people and kind of check in, I'm reviewing your portal and I'm reviewing kind of in my mind where we're going and what we're doing and kind of the game plan even before I meet our patients.
Yeah.
You feel the same way?
Yeah, even before that, we have, when you first call our office, we have individuals who spend time on the phone with you, trying to understand what you're looking to try to understand at that first visit. And they really help guide you to the right spot and the right time, even at that first phone call. And then it is true, we have a very nice online system that we like couples to log into well in advance of their visit and just provide some additional information.
Because then you think about it, we have a head start.
Yeah, I tell every patient the same thing. I hope it's better than filling out a clipboard full of papers when you finally get to our office. If it's all done online, we see it. A lot of that information goes directly into the chart, so you
Right.
can tell us in your own words what you're looking for, and it goes directly into our electronic medical record, so we can always go back and say, okay, this is what the patient is telling us, what they want to find out, as well as all the other medical information and surgical information or any prior information that you come to our
Let me
office
ask you
with.
this. Do you, when you're discussing these and discussing and taking the information from our patients, are you writing a little bit of notes as you go, or you're inputting new information into their chart as you go in front of them?
Yeah, both.
Yeah.
I'll go through all of that information, so hopefully I know everything, all the important points of their history and any studies, any important aspects that they've told us. But then I want to elaborate on that and find out a little bit more. So I'm taking notes that I go back in and put in the record a little bit later, just going over, fine-tuning some of the points.
Talk
that are
about
important.
our first step. I want to talk about some tests because I'm really interested in tests our patients do. Talk about and throw in some discussion on medical history.
Well, that's one of the more important parts of our first visit. Much of our first visit is sitting discussing what's been going on in the past.
Right.
We need to know a lot about the menstrual cycle. We need to know how normal it is. history tells us most about pelvic pain problems. I really try to understand whether or not pelvic pain, because sometimes it's hard to indicate on the form pelvic pain. When is the pelvic pain occurring? What kind of problems? Is it something that's going to be interfering with the rest of the reproductive process? How important is that? And so those aspects of the history are very important. And
one of the things that I like to get into is I love knowing how long someone's been trying, and also about their cycle and kind of what's been going on with how long they've been trying, because I think that's important.
Oh yeah, no, it always is. And a lot of what we talk about at the first visit is also education about what we're looking to do, and education about that next step, including some of the testing that we usually
So
discuss.
let me take that lead from you. I love testing, because what I say to our patients, let's get data, let's get information, because we want to know. So the things I think about in tests are, do we have a sperm count, or we can use donor sperm? Do we have a good uterus? Do we have open fallopian tubes and good ovaries? So we want to make sure the tubes are open, because we know when a lady pops out an egg off her ovary, we need to pick up the egg into the tube. I think about their menstrual cycles. And one thing Shaun and I in RMA were very interested in is, your ovarian reserve. How good are your ovaries? And we can get information on your ovaries by looking at an ultrasound, a couple hormones. So we can, by those tests, and I want you to chime in, Shaun, get a lot of information about your reproductive potential and how we can individualize a game plan for you to make you succeed based upon those tests. You feel the same way?
I agree. And I spend a lot of time talking about the next step as well. And I do want to talk about that a little bit more, but also, at the first visit, sometimes we see just one member of a couple.
Right.
Sometimes it's one or the other partner in the couple. I don't know about you, sometimes we see couples that haven't even tried to get pregnant. Sometimes they're there because they're concerned. There's some anxiety about what they've heard, maybe some past events that have gone on that makes them somewhat anxious about getting started with the process.
So that's interesting. You brought up, you could come on in just for preconception ideas. And so that brings up a thought I was thinking, Shaun, is that some of our patients, I'm not ready to get pregnant now. I don't really want to get so aggressive, but I kind of want to know what's happening. I want to make sure I'm doing my vitamins. I may want to make sure my ovarian reserve, my AMH, my egg test is good. I may want to see our nutritionist, our yoga people, our counselors, kind of get in the zone, get healthy before. But I didn't mean to make a diversion, but something I was just thinking about.
That's there are many patients that I see who don't fall into the category of just infertility. Infertility we think of, that by the definition is trying to get pregnant for 12 months without success. But there are many aspects of a person's history, things that have happened to them in the past, in which we don't want them trying for that long. We want them, at least finding out information ahead of time. If someone has a history of irregular periods, or again, like I said, pelvic pain, or past events, surgeries, ruptured appendix, or anything that's even on the male side.
Kind of taken literally, we know from our society that if you've been trying, let's say you're above 35 and you've been trying a year, try 6 months, if you're above 35 and you've been trying 6 months, come on in and see us. But there are times when, like you said, there's other things that are going on that may make you want to come in and see us sooner, and not be trying out there for too long.
And so, and getting as much information as you need to be comfortable moving forward is part of that visit for everyone, for couples who are already experiencing difficulties, for those who are just starting out and trying. And after that first visit, then we usually like to do some testing, some evaluations, just to understand some of the basic aspects of just the functioning of the reproductive system.
So we've done that. We talked about that, and I kind of touched on that. What do you, touch a little bit, because this is an area of your interest, is treatment protocol and different options. Once we've done testing, let's assume testing is good, and someone wants to get pregnant. How do you talk to your patients about that?
And so at the first visit, after I go through some of my thoughts and my concerns just from what they've told me already, I will talk about those testing processes. Again, there are a few tests that everyone needs. There are a few tests that all of us need to see, regardless of what reproductive endocrinology clinic you're at, which physician you're seeing. There are some tests that we all need to do. And you touched on it before, trying to understand how well someone's ovaries are working. Part of that we get through the history, and I tell all my patients this in our visits. Part of that we get through the history. Part of it is some evaluations of the ovaries, ultrasound appearance of the ovaries, how many little resting follicles they have, their ovarian reserve.
Which is actually a favorite thing of mine is to look at ovaries and count the follicles, because each follicle has an egg, and get an understanding if the ovaries have nice follicles or eggs, and if they're located nicely in the pelvis. And I think, when we sit here and talk about evaluation, treatment, and options, there's 6 board-certified physicians here at RMA, and we're on the same page, and we're a team, and we review and we meet, and all of our patients are going to get the same specialized tests with a different flavor. So I just want to kind of throw that out there. So you were going to jump into quickie on, let's say, ovulation induction and IVF.
Right. And
bring us through that.
And I'll talk a bit at the first visit. If I have an idea about what's going on, what problem may be there, I'll talk specifically about some of those treatments once we have all of the information. Again, all the information would include understanding the fallopian tubes with hysterosalpingogram, and people need that test. The only way we have of knowing if the tubes are open or not, in a non-invasive fashion, we'd always do surgery and look in and see if the tubes are open, but that hysterosalpingogram test is important. And ultrasound of the uterus, we also like to do the saline sonogram, flushing some fluid into the uterus just to make sure there are no polyps or other irregularities. And of course, most important test for male partners is the semen analysis. And that's essential. I know I have a lot of couples that are like, well, can we do some tests first and then see if that's normal and do that test later? I always tell them it's best
to have to do it.
All of the information at once, just so as we come up with a treatment plan, we'll know all of the information together. Because
you can't
a
miss
large
out.
percentage of patients have abnormalities on both sides.
It's interesting. Years and years and years ago, the reproductive doctors weren't as aggressive and kind of backed off on some different tests. And like you're saying, it's nice to know kind of everything up front because you don't want to miss anything.
Yeah. Those are the essential tests, and everyone needs that. And I think all of us would agree, and any clinic you go to, we agree that there are certain aspects of the evaluation that you need. There are some tests that need to be done. Now, some patients have had some testing already.
And
then they come in. Some tests, some tests that have been done at their OB's office, their GYN office. Sometimes someone comes in with a hysterosalpingogram or a semen analysis, and that's great. That's good information to have at that visit. That's less information we need to get together. But there are still other things that we need to know at the beginning. Sometimes if it's been a little bit of time between evaluations,
you may want to redo it.
We'll want to look just because things change.
Now, when you get so when you've done your first visit and on our second visit, that's when you're probably, and I'm going to talk about helping you get pregnant, doing something called superovulation and artificial insemination, or doing in vitro, and doing in vitro and looking at embryos and making sure they're good. Sometimes we do in vitro because we have couples who come in who have known genetic diseases and we want to biopsy embryos for a certain disease process. So we will talk about that. Not so much in the first visit, but we all know that's something we do out there. I wanted us to transition and talk about some of the things we're really happy about and proud about here at RMA. So one of the I think we have 3 or 4 buckets, and I'm going to start off kind of with one, is we have our integrated fertility wellness group. And that's something dear to our hearts. And a lot of our patients who are coming through, not, once we kind of get them going, are going to want to, get their nutrition in good order. They may want to de-stress and kind of get into the zone and do yoga with Lisa, or maybe see one of our acupuncturists and kind of have a moment of relaxation, maybe help their ovaries. We see events like Single Moms to Be. We have our reproductive coaches. I say coaches are reproductive counselors who are very well trained, and they're here full time, which is unique. Shaun, I think it's unique that we have these people here full time with us, and they're here to help our patients, because when our patients come in, sometimes they need, not you and I, they need other people to kind of get them on track. Right. So that was one topic I wanted to throw out. Why don't you jump into a topic? Yeah,
it's a wonderful environment that we have here. We have many people here just to help with each step along the journey. in our integrated fertility and wellness program. A lot of times at the first visit, I'm focusing more on the medical aspects of what's going on, the testing that we're going to be doing, the education around the thoughts that we have, especially as it comes into formulating a treatment plan. But everyone can benefit from some of the additional
TLC.
Exactly.
Yeah.
Everyone can benefit from the expertise of Carolyn Vendel, our nutritionist.
Right.
And
Who's amazing, by the way.
it is.
Who I
And,
met with.
you know, it's a,
And by the way, Shaun, I was going to say we have pretzels here, not chocolate, because we're being good and having good snacks. The other interesting thing that we have going on is, so remember, the Connecticut mandate is a bill that the governor signed years ago, and that bill allows our patients to do three artificial insemination cycles and 2 IVF cycles. And the reason why we bring it up is because it's dear to all of our hearts, all the 6 doctors here, because we've all gone to Washington and fought for this. This is a mandate. It's an opportunity for some of our patients to get treatment. And what's nice is the mandate allows some of our patients to do this treatment.
Right.
So we're very proud of it. We also have our LGBT community, which is very, very important to us. We're a distinguished leader. We're involved with the Human Rights Campaign Foundation. We're a group of excellence on that. And the reason why I bring that up is because Shaun and I believe that we want family building. We want people to have families. We want to do it in a very, very respectful way. And we're here to make it happen. I'm going to highlight to Shaun and throw the football over to him, talking about his fertile familia, which is another really cool advocacy situation.
Right. Well, we have a team of nurses and medical assistants here, as well as myself, to take care of those patients who primarily speak Spanish as a first language. We have many members of our staff who are fluent in Spanish.
And you are too.
And I try the best that I can.
You do a good job.
But our program, Fertifamilia, is specifically designed for those couples who, are more comfortable talking about some of these issues and having all of the education explained to them in Spanish.
And you've done your consent forms and you have information in Spanish, right?
Right.
So you headed up that group really, really well.
And so our patients really appreciate that.
Yeah.
They appreciate us, getting the information to them and communicating them and helping them in their family building goals just within what they're comfortable with. It's not a very comfortable sometimes environment to be in when you're
But
here.
if they can come talk to you and communicate well, it's going to be great. A couple other things as we're sitting, and I know we're going to wrap up at some point. Important to us is the fertility preservation bill. Big, big, big deal. So we're the first state. Again, doctors here have pushed for this. Lisa Rosenthal has pushed for this. This is a big deal, where we're the first state in America to basically say, you know what, our patients who have a cancer, we're here to help you. We're here to help you with the process. We respect what you're going through, and we're getting, without saying too much or saying anything incorrectly, we're getting our insurance companies to be involved to say this is very important, and we want to allow our patients to freeze sperm, freeze embryos who are in this complicated situation. And fertility preservation to both of us in this office is very, very important. Keeping hope open.
It is, yeah. And our goal is helping couples build their families.
Right.
And so we've talked a lot about some of the aspects of infertility for couples that are actually experiencing some of these problems. But we see, many different types of patients here at our practice.
What about our single moms to be?
We see women who are looking to build their family using the what we have to offer to help them get pregnant as single women, as same-sex couples.
Yeah.
We have both male and female same-sex couples who are here because they need to, and we fight for these couples to help to give them that opportunity.
So basically support and respect.
Yeah, and we
get it going.
we one of the aspects of the first visit that beyond when patients come to see us, they spend a lot of time with us as physicians. Then immediately afterwards, they're meeting with their individual nurses who will be their nurse to take care of the patient throughout their time here. They meet with a member of our team called the navigator, a patient navigator.
I like that you're reviewing this, Shaun. Keep on going.
Who's there to help the patients or help the couples schedule the appointments, make sure that they know exactly what the next step is, because it does get a little bit complicated as they enter into treatment, as they go through evaluations, and then eventually, or at the end of the visit, they're usually meeting with one of the financial coordinators here in the practice, and that's important. Here in Connecticut, we do have this state mandate that requires coverage and treatment for many individuals, but it doesn't apply to everyone.
Right.
And understanding the ins and outs of the coverage that couples have is important, because there are many individuals who don't have coverage for some of the things that we want to do, and then focusing on what the cost could be, and answering those questions.
Right.
Because some couples come in here and they have this idea that things cost hundreds of thousands of dollars, or at least tens of thousands of dollars.
So we want to make it, kind of what you're saying, before they leave, we want them to know the different people who are going to help them, so that during the process they can engage with them. So that's why we have our team approach. Well, I would tell you that, do you have any last words? You're good? I think this is a fantastic kind of fireside chat with Dr. Williams and myself. Again, we're here to advocate for our patients in a great atmosphere. When you come to our practice, you'll see how friendly the staff is and how much we want you to succeed. Any closing comments?
Yeah, no, I hope we can continue to have more conversations about this. Please, active on our Facebook site. Take a look at all of the other wonderful programs that we've put on there. A lot of Facebook Live events.
So single moms to be, gay parents to be, RMACT, and they can just learn and
other
be with
websites, right? SingleMomsToBe.com, GayParentsToBe.com. All of these are great resources, even before you come to see us.
take a peek.
And we want patients to feel that they're getting everything that they need, all the education, all the support that they need. That's really what we're all about here at Reproductive Medicine Associates of Connecticut. And all of these things that we do are there to help you reach your goals as quickly as possible.
Okay, well, have a great afternoon, and thank you very much.